Hi, I'm Dr. Manu Gujrati, and I'm the Medical Director of the San Francisco office of Parsa Mohebi Hair Restoration. And today we're going to talk about the Propecia question, or finasteride, and whether or not somebody needs to be on it before an FUE procedure.
Hi, I'm Dr. Parsa Mohebi, Medical Director and founder of Parsa Mohebi Hair Restoration.
Propecia, or finasteride as it's known, is valuable before an FUE procedure for most patients because it can prevent one of the common side effects of surgery. In hair transplant procedures, your transplanted grafts are going to be visible for a few weeks and then they're going to shed. And then they're going to grow back in a few months. There's something called shock loss. And shock loss is when your natural hairs that were already there before the procedure, they get fooled into shedding as well. There is research that shows that being on finasteride for at least a month before your procedure helps cut down the risk of shock loss happening. And so basically it decreases the risk by 50% of that happening. That being said, most times we'll say the risk of shock loss is not great. It's 10 to 15% of patients that it happens to, where it's really noticeable. But by being on Propecia or finasteride, you can cut that risk down to less than 10%. And so that just means you're going to get back to having your normal kind of hairstyle faster. That being said, you're still going to recover from shock loss in the first few months. So if it happens, it's not the end of the world, but it's just taking a little bit longer to that full recovery time. Okay, everybody, hopefully that was really informative about understanding the benefits of Propecia or finasteride before an FUE procedure. But if you've got more questions, visit us at parsamohebi.com, or you can find us on social.